Okay, hello everyone, and welcome to our fourth topic in Nakui's Project First Line training series for our frontline workers, COVID-19 and infection control. Today's topic is a closer look at hand hygiene. Infection control is literally in your hands. And this question is asked in the context of the current global COVID-19 pandemic. Before we begin, please note that this session will be recorded for educational and quality improvement purposes. Nakui will be utilizing the recording to continue to share and educate frontline healthcare workers throughout this pandemic. Thank you. We are very pleased that you could join us today. It is our hope that this forum provides an opportunity for you to gain knowledge and foster best practices as it relates to infection control. During each session, we will hear from our experts as well as offer opportunities for you to ask questions regarding the topics covered. My name is Melissa Watson, and I am Nakui's Project First Line Public Health Project Assistant, and I will be your host today. If you do have any IT difficulties during today's call, please chat directly to Noelle under Comms and Events in the direct chat, and she can assist you. Finally, we just ask if you could please enter your name, your UIO or external organization name, and any tribal affiliations into the chat box so that we can get to know each other and count your attendance for the day. For our agenda today, we're going to feature a brief recap of Nakui as an organization, Project First Line, as well as our Project First Line team. Then we will move into our training on hand hygiene. After our training, we will then be divided into our groups for our 3 breakout rooms to discuss certain questions applying to what we will cover today. Finally, we will wrap up together as a group to share our thoughts and ask any questions. Also, I would like to remind everyone that as we go through the training, you will see information sourced on each slide. We will be sharing all of our resources, not only in the chat today, but in a follow-up email with a recording of this presentation, as well as the slide deck. So to begin, we want to give you a quick background on Nakui. We are a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. Nakui is the only national representative of the 41 Title V UIOs under the IHS and the IHCIA. Nakui strives to improve the health of over 70% of the AIAN population that lives in urban areas, supported by quality, accessible healthcare centers. We would also like to thank the Centers for Disease Control and Prevention for their continued support. Project First Line is a national collaborative led by the CDC to provide infection control training and education to frontline healthcare workers and public health personnel. The contents of this program do not necessarily represent the policies of OSHA, CDC, HHS, and also should not be considered an endorsement by the federal government. Next, we would like to reintroduce our Project First Line staff here at Nakui. Dr. Kimberly Fowler is our Vice President of Technical Assistance and Research Center. Zipporah Fuller is our Director of Technical Assistance. Evelina Maho is our Public Health Program Manager. Diana Pejuan is our Senior Project Manager. Tiffany Stark, our Public Health Program Assistant. Noelle Zelke is our Communications Associate. Alexander Zamo is our Statistician. And Karen Kwok is our Subject Matter Expert. We would also like to welcome our trainers for today. We have our special guest from Denver Indian Health and Family Services. Aron is the Contracts and Grants Program Manager at Denver Indian Health. He is an enrolled member of the Comanche Nation of Oklahoma, who holds his Master's of Science in Wellness Management Health Promotion. He has worked in tribal public health for 7 years. And we would also like to welcome Robin, who is a full-blooded Dene from Denver Indian Health and Family Services. Robin is a registered nurse who graduated with her background mostly in emergency medicine. She has also been an ED-RN for 10 years and has worked for Gallup Indian Medical Center and the Gila River Indian Community, as well as many other non-Indian organizations. Next, we want to recap what Project First Line is for everyone. Project First Line is CDC's national training collaborative for healthcare workers focusing on infection prevention and control. Every frontline healthcare worker deserves to understand infection control principles and protocols so they can feel confident to protect not only themselves and their families, but their patients, facilities, and communities. Project First Line is designed to help the frontline healthcare workers to gain confidence and knowledge through these training collaboratives. And then lastly, we would like to provide you with our post-evaluation survey links for you. We will be providing a link in the chat now, as well as at the end of this session today. We ask if you could please complete our survey at the end of the session and let us know how we can serve you better. Your evaluation of the training content and delivery will enable us to meet your training needs and improve the quality of our program. So with that, I will now hand over our training to Aron and Robin.
All right, thank you, Melissa. In today's training, our 4 major objectives, as shown on the screen there, will include taking a closer look at hand hygiene, understanding the proper technique for hand washing and alcohol-based hand sanitizers, understanding the importance of hand hygiene in COVID-19, as well as engaging in discussion around hand hygiene at the place of work. Now we'll begin our training. Series COVID-19 and infection control. Topic, a closer look at hand hygiene. Infection control is literally in your hands. Before we begin to discuss the importance of hand hygiene, we must recognize why it's so important. With our training emphasizing COVID-19, we must remember how COVID-19 spreads. Respiratory droplets is the water in our breath that may carry SARS-CoV-2, which is the virus that causes the disease COVID-19. It's infectious and is transmitted between people. Respiratory droplets containing the viral particles not only travel through the air, but can also land on hard, non-porous materials like metals and plastics, areas where our hands touch. Airborne droplets can be inhaled by others or land on their eyes and infect them in this way. So how do we keep ourselves safe from getting sick? Let's define hand hygiene, which is the cleaning of your hands either by hand washing with soap and water or by using antiseptic hand wash or rubs, also referred to as hand sanitizers. According to the CDC, hand hygiene is an important part of the US response to COVID-19. It is a simple yet effective way to prevent the spread of pathogens and infections in healthcare settings. And Tiffany just dropped a link in the chat to the CDC hand hygiene for healthcare providers. So take a chance and click on that so you have it for reference. So during routine patient care, what do we use when to clean our hands? On the left column, you can see we cover when to use alcohol-based hand sanitizers, and on the right, we cover when to clean our hands with soap and water. Per Dr. Abigail Carlson of the CDC, another thing to remember is that this is not meant to be an exhaustive list. Whenever you think your hands have gotten dirty or whenever you think it's important for your hands to be clean, you should clean your hands. So when we clean our hands, we help to stop the spread of germs. Whatever our hands touch gets onto us, and whatever is on us gets into what we touch. We also have to protect our patients. During the course of our daily routines, we engage with our patients who more than likely have a lowered immune system. We come into contact with germs, bodily fluids, etc. For example, on average, a nurse will touch 15 different surfaces in a single patient encounter. This correlates to 912 surfaces touched in a 12-hour shift, which is a lot. So by continuously keeping our hands clean, this helps to eliminate the spread of germs from all over those surfaces and patients over time. And Tiffany dropped another link into the chat, which is a CDC video log. Do we really have to talk about hand hygiene? Yes, we do. So how are germs spreading from us to our hands? Hands are very welcoming to germs due to the warmth and damp areas between our fingers and under our nails to any broken skin we may have. By cleaning our hands, we're also removing some of the germs and even killing them. Viruses can easily travel on the skin of our hands. Being in the healthcare setting, we spend our days in facilities with increased level of germs, increased levels of exposure. Cleaning our hands is essential to infection control. So let's not spread any germs if we can prevent it. This next graph is from a study posted to the Morbidity and Mortality Weekly Report, which analyzed the COVID-19 hospitalization rates in 13 states during March 1st to May 31st of last year. Though the routes of transmission of the virus is not specified in the graph, it does drive home the need for continued training in infection control. Healthcare workers classified as others is not included in this graph. The healthcare personnel ranged from nurse to home health to physicians and chiropractors. 6% of the adults hospitalized were healthcare providers. Among them, 36%, as seen in the graph shown there on the screen, were in nursing-related occupations. This report and others like it show the strong correlation between infection control and roles/level of potential exposure in the healthcare field. So what are the implications for practice? Healthcare providers can have severe COVID-19 associated illnesses, highlighting the need for continued infection prevention and control in the healthcare settings, as well as community mitigation efforts to reduce SARS-CoV-2 transmission. So let's see, Tiffany should drop another link in the chat, which is COVID-19 associated hospitalizations among healthcare personnel. Now we'll move on to our knowledge check. So this will be the first knowledge check of the presentation. It should pop up on your screen now. And this is hand cleaning is extremely important, especially in healthcare, as we come into contact with patients who may have already compromised immune systems. So do you guys think that's true or false? We'll give everyone a few moments to respond, and then we'll share the correct answer. So it looks like everybody has responded to that, or they're still coming in, a few of them. Yep, okay. So that one is true. Glad to see that everybody got that one correct. And thank you for participating in that. So just to recap, our hands have a lot of stuff on them, including germs. Some of the germs that we carry on our hands are viruses like the SARS-CoV-2, which causes COVID-19, along with bacteria and fungi. Because we use our hands so much, they are the key germs spread within healthcare. Proper and frequent hand hygiene, like washing our hands or using alcohol-based hand sanitizers, can help prevent the spread of germs. Now I hand it over to Robin to walk us through the rest of the training. Oh, Robin, you're on mute.
Sorry, guys. Thanks, Aron. So let's briefly recap what we are likely, when we are likely to clean our hands. Immediately before and after touching a patient or their immediate environment, before moving from a soiled part of a patient's body to a clean part, after coming in contact with blood, bodily fluids, or contaminated surfaces immediately after glove removal, before or after eating, as well as using the restroom, and when you think you've gotten your hands dirty. Tiffany is going to drop a link into the chat. This is on CDC, when and how to wash hands. So what should healthcare facilities do? Healthcare facilities should require the healthcare personnel to perform hand hygiene, and also ensure that the healthcare personnel are performing hand hygiene with soap and water when their hands are visibly soiled. Also, ensure that supplies necessary for adherence to hand hygiene are readily accessible in all areas where patient care is delivered. Lastly, we be sure to provide routine training on proper hand hygiene techniques to all staff and employees. Hand hygiene techniques. The steps needed to utilize when washing our hands are as follows. Wash your hands first with water. Apply the product. Rub vigorously for at least 20 seconds. In some places, you'll see 15, but technique is what is important. Rinse with water and use a disposable towel to dry. Be sure to use the towel to turn off the faucet. Be sure to use the cleanest water possible and form a good lather. By forming a good lather, pockets are formed called micelles that trap and remove germs and dirt. Avoid hot water to prevent skin drying. So how to wash hands. The World Health Organization recommends the following 12 steps as a guideline for washing your hands. And I'm sure you have seen these pictures all over the hospital, above your sinks, and on how to properly wash hands. So right here it says wet hands with water, apply enough soap to cover all hands, rub hands into palm, and then it will continue. We'll watch a video. I believe in the next step, we'll watch a video to observe the technique in action.
My name is Lauren Hinkle. I'm an infection preventionist at Nebraska Medicine in our infection control and epidemiology department. We're going to be showing you how to wash your hands with soap and water with the appropriate method. The Centers for Disease Control and Prevention says to wash your hands for a minimum of 20 seconds. I'll be showing you the World Health Organization's methods, which take about 40 seconds. Water temperature when washing your hands does not matter. What really matters is using the appropriate amount of soap and water and using really strong friction and rubbing your hands for the appropriate amount of time. Start by getting the soap wet and washing it over your hands. Interlace your fingers with your palm, touching the top of your other hand, and then switch to the other side. Place your palms together and interlace your fingers and rub back and forth. Rub rotationally on your thumbs and switch to the other hand. Cup your fingers and try and clean the tips of your fingers and your nails. Open up your palm and move within small little circles, and then switch to the other hand. Finish off the time by rubbing it all over your hands, and then you can rinse. Use a paper towel or something to dry it with. Dry your hands, and then use the paper towel to turn off the water. Hand washing is our best way to prevent infection. Using soap and water is preferable, but if you do not have soap and water in a sink handy, you can use hand sanitizer as a second option.
So, hand washing do's. When it comes to hand hygiene, what should we be doing? Washing your hands after using the restroom, before eating, when visibly soiled, dirty, before and after caring for a patient, before and after treating a cut or wound, before and after putting on PPE, using warm or cold water, wash hand for 20 seconds, minimum of 15 in some places. Tiffany is going to drop a link into the chat. This is for the Golden Valley Health Centers. So hand washing don'ts. What not to do is as follows. Don't use hot water. Don't use antibacterial soap. This may contribute to antibiotic resistance. Use dirty or contaminated water. You can be putting germs back onto your hands. Use hot air hand dryers. Touch the sink or fixtures immediately after washing your hands. No cross-contamination. Forget to wash between procedures, even with the same patient. Hand hygiene techniques using hand sanitizer. When using alcohol-based hand sanitizers, be sure that it contains a minimum of 60 and up to 90% alcohol. It is most effective for reducing the number of germs on the hands of healthcare providers. You begin with putting the product on your hands and rubbing them together. Be sure to cover all surfaces until your hands feel dry, approximately 20 seconds. WHO has also shared their 8 major steps within this guideline to show how to utilize hand sanitizer. So this is the one we saw. You've probably seen this one too, hanging in your organization. You apply a palmful of product into the cup hand, covering all surfaces, rub hand palm to palm, right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced, back of fingers to opposing palms with fingers interlocked, rotational rubbing of the left thumb clasped in right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers or of right hand in left palm and vice versa. Once dry, your hands are safe. Knowledge check number 2. If you could please respond to the question on your screen. Per the CDC, what is the minimum percentage of alcohol that should be in a hand sanitizer? 50%, 90%, 60%, or 30%? We'll give you everyone a few minutes. Give everyone a couple minutes. All right, and the correct answer is 60%. Thank you all for your participation. Hand sanitizer supply and its impact to operations. As we mentioned in the last training, there have been a few shortages when it comes to supplies within the healthcare industry during the COVID-19 pandemic, and hand sanitizer was one of those items at the start of the pandemic. Please feel free to indicate in the chart, is your facility still experiencing shortages of hand sanitizer? And if you had to make your own recently, we would like to have an idea if this issue has been resolved in our UIOs. Months ago, in response to shortages, the FDA created a temporary policy for compounding a certain alcohol-based hand sanitizer. This allows for the use of ethanol and isopropyl as an active ingredient to be used even if its entirety is not registered with the FDA. Healthcare facilities, however, are recommending to return to using FDA approved as soon as supplies become available. Also, if used, it is recommended by the WHO that a 72-hour post-production quarantine occur to avoid contamination. USP hand sanitizer toolkit. The UMass Pharmacopoeia has an excellent toolkit for hand sanitizer. We have an image shown here, as well as in resources at the, we have an image shown here, as well as resource at the bottom of the slide, as well as shared in the chat by Tiffany now. The hand sanitizer toolkit is to be utilized to help remain vigilant, to help ensure the quality of alcohol-based hand sanitizers throughout producing, including the ingredients, labeling, packaging, transportation, and storage should the need arise. We do not anticipate that this will be the case. Tiffany will drop that link in there. Here we see the overall formation of three compound alcohol-based hand sanitizers for COVID-19 use. The link for the toolkit will be provided in the chat. Again, we will not recommend facilities compound their own sanitizer unless there were no other option for hand hygiene. As we are reviewing hand hygiene, we have to be sure to pay attention to one of the areas on our hands that germs love to hang out in, our skin and nails. First, with our skin, be sure to keep them moisturized to protect from dryness. Be sure to use only lotions that are approved by your healthcare facility so they don't interfere with any hand sanitizing products. All fingernails should be natural and less than 1/4 of an inch long. And a note on rings. Studies are still being shown whether germs are increasing. On a note on rings, studies are still being shown whether germs are increasing or not under our rings, but please be aware of those areas when washing your hands. Knowledge check. And to conclude, we would like to end with one last knowledge check. When washing our hands, what water temperature and can increase the risk of skin dryness and irritation, hot, cold, or warm? Please take a moment to respond to the question as it has popped up on your screen. Just give everybody a little more time. And the correct answer is hot. And now I'll hand you over to our subject matter expert, Ms. Aron Kwok, to provide her commentary. Karen is a family nurse practitioner and technical advisor who has over 20 years experience. She works in direct patient care and service delivery operations workflow in infection control and prevention. And we are happy to have her here with us. Karen, I will give the floor to you.
Thank you, Robin and Aron, for that informative training. And summing up what we've covered so far, we took a closer look at hand hygiene, reviewing how it is important in the U.S. response against the COVID-19 pandemic. We reviewed how there is the proper technique for hand washing with soap and alcohol-based hand rubs with the resource links shared. We also discussed the implications for frontline healthcare personnel in protecting themselves, patients, staff, family, and community members, because it's in our hands. With the estimated over 900 surfaces touched during our shifts, we can easily see the need for continued infection control in healthcare settings, where healthcare personnel have severe COVID-associated illnesses, therefore highlighting the need for continued infection prevention control. I am excited for the breakout room sessions where we can apply these learning principles on hand hygiene and further discuss our facility successes. Thank you.
Thank you so much, Karen, and thank you so much to Aron and Robin. You both were fantastic. We appreciate you being here for our trainers today. Now, as Karen mentioned, we are going to go into our breakout room. So in just a moment, you're going to see pop up on your screen the image that you see in the bottom left here to join your breakout room. So once you see those, please jump in. We will assign each room one question. We'll take about 10 to 15 minutes to discuss as a team, and then we will come back together to talk as a group. So thank you all again, and we'll see you back in a couple minutes. All right, thank you all. And thank you, Noel, for bringing us all back in. I'll give it just a second. It looks like we're all back in the room, right, Noel? I can see you. Okay. All right. So thank you all for joining and for going through with our questions. What we're going to do is actually just go around, and I know each of the rooms had assigned a speaker for the room. So the first question was, what challenges does my organization face with hand hygiene, and how are we addressing this? If we want to start off with that, I believe was from Evie's room. So group number A.
All right.
Great. Aron and Mary were in that group, so they'll be reporting out. Thank you.
Thanks, Evie. Yeah, so in our group, we discussed not really having, well, one of the challenges that was brought up was not only training and educating staff about proper hand hygiene, but also patients coming into the clinics before, during, and after visits, and then also utilizing the time after providing COVID vaccines. You know, the patients have to wait 15 to 30 minutes, utilizing that time to continue the PPE education, hand hygiene education, you know, all of the continued safe guidelines by CDC and other organizations. So taking that time to also train the patients. And then in terms of what nakui could provide UIOs for resources around this topic, could be, we had talked about our organizations implementing annual trainings and also trainings for new staff, but having some sort of recommended or standardized competency checklist or survey or quiz. That way, if one person in the organization chooses to use one specific hand hygiene training and competency, that we could have kind of a base resource in case that staff leaves or new staff transitions, just to have kind of one solid resource that's a recommended competency checklist or quiz or survey. And then also maybe getting a resource around approved products for hand hygiene that we could then share with our patients, because it was indicated that patients are asking questions, well, can I use this one? Can I use that one? And rather than referring them to FDA guidelines and, you know, telling them to look on the products, of maybe just having a general list of available products could be helpful. And that was it from our group.
Great. Thank you so much, Aron. Next group was Group B. How is your organization assessing competency on hand hygiene, assessing, documenting, training, etc.? So if we could have our speaker from Diane's group, please.
Right. So we had Robin in our group from Denver, along with Teresa and Tony from Mantia, California, Three Rivers Indian Lodge. But for some reason, Tony's microphone wasn't working. So we were able to go through a couple of points. The facility in Mantia, California, Teresa's facility, focuses on drug and alcohol substance abuse. They have 4 clients, which they see on a standard basis. So their training is organized a little bit differently than in Denver, where a number of services are provided. They've got medical outpatient, pediatrics. They see pediatric and geriatric patients. They have a dental facility, physical therapy, behavioral health, along with diabetes, and a wellness department. In terms of assessing and documenting training, they have hand hygiene training where they review steps. They have peer review. They have a reevaluating process. They will train at intervals and have the process streamlined. They're documenting competencies as well as reviewing each other for under peer review. What they will be doing in the future is implementing audits as they develop their programs. As it relates to Teresa's facility, they are doing independent training. They're attending webinars similar like what we're doing today. Their staff is provided with supplies for hand hygiene. This is reinforced. And during the pandemic, they actually have hand sanitizers at their desks that they're using around the clock. But we got pulled back in. So that's where we got. So I'll hand back over to you.
Thank you, Diane. And then for the last group was our group, my group. How is your organization ensuring proper hand hygiene during the pandemic and vaccination campaigns? And with myself was Haley, who is one of our Project First Line fellows, and then also Johnny and Candy were with us. But I will actually hand it over to Haley for our report out.
Hi, yeah, so we kind of touched a little bit on, I think, each of the different bullet points, and we talked about how the competency is there and the trainings are there. Or actually, I should say that the competency wasn't for sure if they're always doing it right, if the different employees and different staff are always washing their hands the right way. So both sites were looking to implement audits as well, and kind of make sure that there is I guess a system in place for doing it the right way, and then also thinking about doing documentations on a monthly basis, and that also goes for the trainings as well. There was also different talks about the different trainings that they have now implemented and what they hope to change in time. And then we kind of talked about different preferred methods of hand washing, hand sanitizing, and then also how patients receive and kind of interpret those hand washing techniques, such as hand sanitizing, and being with some patients who are in that substance abuse and use prevention models. And then there have been challenges, again, just to ensure that compliance. And we were starting to talk about support and successes for reinforcement of those of hand washing and sanitizing, but we didn't get too much into it. But I think Johnny was going to talk about it a little bit about UV lights and then sanitizing that work area and workspace. So the time went by really fast. Hopefully I touched on everything. Yeah, please.
You did a great job.
Thank you. Thanks.
Karen, would you like to touch on anything? I know you were able to bounce into all three rooms to just tie it all back together for us.
Thank you, Melissa. I loved how we came full circle where we discussed how the culture of safety is not just amongst ourselves, but how we are instructing our patients and ensuring that they are empowered with this knowledge as well. And the take-home points that I have in how we can collaborate and really bolster the efforts of all of our UIO partners is ensuring that there are the standardized competency assessments such that there is improved efficiency, consistency in our training of one another, whether that be a supervisor or a peer. And I really like, I believe in Mantika, it was the peer review systems in keeping each of us accountable. And hand hygiene, again, is literally in our hands, all of our hands. So I'm really glad that we were able to share those successes and to look upon one another for that continued effort and support in that. Thank you.
Thank you, Karen. And thank you all so much for your discussions in our breakout groups. We hope that this is as helpful for you as it is for us for learning from you too. Noel, if I could just ask if we could bring the PowerPoint back up. I believe we do have some time next for some question and answer, but we do want to just remind you that we are coming towards the end of the presentation and we will drop the survey link in there for your reference. We do value your feedback. So the things that you are telling us on these surveys is what's helping us to create these next modules for you. So we want to be able to serve you as best as we can. But next, I'll actually hand it over to Diane, that if we do have any further questions, we'd just like to open the floor for everyone. Oh, Diane,
Just
there you
realized I was
go.
muted. Yes. Thank you, Melissa. In terms of the hand hygiene training portion of it, of what we just went through, it was quite a lot of information. I know that since the pandemic started, that things have transitioned. Folks are washing their hands. They are using the sanitizers. Sanitizers are placed in key locations to which people have access. And in terms of the training, we are reiterating the steps. Are there any questions on what we have provided, or are there any questions about what you would like to see more of, or questions about anything we need to elaborate on? Feel free to type in the chat as well, or you can raise your hands. So Teresa shared that this is very good information. Thank you, Teresa. We'll also be following up and sending you a copy of our slides and a copy of the resources that we shared. I know, Johnny, you got cut off during your breakout. So if there's anything special that you'd like to add while we're here, please go ahead and do that in the absence of questions. Johnny?
No, I was just sharing before we got cut off that my organization has UV lights that we purchased. Basically, they're about, well, I don't know if you can really tell how big my hands are, but they're about this long. And it's just a UV light. You put it close to in front of the object, a certain distance away. For COVID, you sit it there for 5 minutes. It kills other viruses as well. But we use it to disinfect our workstations at the end of the day. We have the wipes they have in the hospital to wipe down our workstations though, but the lights make it easier. And it's also another step to prevent the spread of infection. And then we can also use it on material objects as well, which the wipes don't really work well on material. They get wet and such. So it's just another way to doing it, including our vehicles as well. So someone goes on a transport, they take the light with them. When they're done with it, everywhere that was touched, or we did a transport and somebody sat in the back, we use the light on it. It's battery operated, it's rechargeable. So they work great, a little pricey, but we got a few of them throughout the office.
Thank you, Johnny. Karen, I will defer to your expertise. Any comments regarding the UV lights?
I appreciate, Johnny, the adeptness, nimbleness that you speak of for clinic and efforts on trying to be clean and to use UV light. Now, there hasn't been a specific device or actual amount of UV that has been studied to be the most effective, but we actually would love to invite everyone to stay tuned because we do have a section on environmental cleaning. And so you definitely teed us up for that. I appreciate it, Johnny.
Thank you, Karen. And I do have a comment by Marilyn Billy. She added that we use, and Marilyn, please correct me if I say this the wrong way. We use Fizuta, which is Lakota natural soap, as a gift with an attachment for our patients during post-COVID-19 vaccination to help foster patient engagement and hand washing. I think that's a great idea. Is there anything you'd like to add, Mary, to this? Or did I say Fizuta the correct way?
Yes, you did. It's actually been a very, very positive response. We've actually had patients respond to us via handwritten notes. We actually just received one today from a patient thanking the staff for the education on actually how to hand wash properly. And then itself just makes them feel a little special to get kind of a fun little gift like that, and it's natural.
That sounds wonderful.
I have a question for the Lakota soap. Did you guys send that out?
That came from UIHI in Seattle. And then what we did is when we got our box, it worked so well. We ordered a massive shipment from the folks who made it. So
we got a box too, and I think it was from the same place.
Yeah, I think they did a shipping to all the urbans, and boy, as soon as we got it, we started using it, and everybody just loved it. So we did a big order with them, and it's lovely. It actually has, you guys know, it has sweetgrass. Some has sweetgrass, some has sage. It's just such good. Yeah, it smells really good.
We didn't do the soap bars in the office because of the whole COVID thing. We didn't want something. I mean, right. Soap, it's clean, but We
Right.
have a touchless dispensers because everything's supposed to be like kind of hands off. But
Yeah.
we have a COVID clinic, so we're hanging them out as part of our COVID clinic though to promote, hand washing, and we have a little flyer on how to properly wash your hand with it as well. So we give out the bar of soap and that while they're basically waiting to be supervised for that 15 minutes after they get their shot.
Yeah, it's a wonderful tool because it makes people feel special too after they've had their vaccine. They get like, hey, I get a treat too.
And it's made by natives, so it's like native
Yep.
soap. So it's like
Hey,
fancy
that's
soap.
I like that.
Yeah.
Marilyn, would you care to share your supplier with us in the chat for any UIOs who might be interested? Or if you
Sure.
can't
Let me quickly find it.
take your time. You can send it to us by email as well.
Okay.
IPC@nakui.org, and we will share it with everyone
I
here.
just placed the order 2 weeks ago, and of course, I didn't even know how to turn my mute on, so to try to find that number is going to probably be a little bit challenging right now. So
That's
I
fine.
will-
You can send it to us later.
Okay.
Thank you. Evie has shared something in the chat, and I just want to go ahead and read that. She says, please feel free and welcome to take the PowerPoint slides that we have to your internal organization as a part of the training effort. And we can send you the slide deck so you can tailor that to your needs. She says, and Mary, that is wonderful. Thank you for sharing. Robin is very much interested in the soap. So yes, Robin, we will share.
I actually found it.
Okay. Feel free to drop that in the chat.
All right, I'll send it to you right here in a second.
Okay, great. So in the interest of time, I will hand over back to Melissa. For everyone here, we will ask you to complete the post-evaluation survey. It's critical in terms of how we assess our training and how we're delivering our training. All of this feedback is pilot testing. This training module that we will be sharing your feedback to the CDC to improve the quality of our training. Melissa has dropped the link here. We will give you 5 minutes at the end of the session to sit with us and complete the survey so we don't forget, which is an option for you. So Melissa, I hand back over to you. Thanks, everyone.
Thank you. And thank you all for all of your commentary and the questions. It was a great discussion again. As always, we can count on all of you. But as we looked at the end here, as we mentioned earlier, we have the resources. So again, you will get a copy of our presentation today. So everything that is cited here for you, there are links to the videos, links to the PDF handouts that we have. They'll all be attached for you here on these last, I believe there's 3 slides for the resources. So then we can go next into our next upcoming events. Our next training topic is going to be on donning and doffing, a key to remember. It will be on April 15th at 2:30 p.m. Eastern Standard Time. And you'll have a chance to work in groups where we do our breakout rooms on your own keys to remember the order to don and doff during the pandemic. So stay tuned, that invitation will be coming out shortly. We also would like to remind you on April 20th at 1 p.m. Eastern Standard Time, we're going to be having Weaving Calm, a strength-based approach to addressing stress among urban Native youth during COVID-19. And then also we would like to remind you that we have our virtual NAKUI conference coming up from May 25th to the 27th. Registration begins on April 1st, so please be sure to keep an eye out for that email so you'll be able to register with us. And again, May 25th to the 27th is our virtual conference. And lastly, we do have the link in the chat box for you to use, please. And we thank you again for your time today and appreciate you all, and we'll see you in a few weeks.